All right, today we're going to talk about past medical expenses. Now, for most people, this seems like a no-brainer. You go to a jury trial, you show the jury what your medical expenses are, and that should be a no-brainer line item on the jury charge that they fill out. Not so fast. Many times, the defendants will hire experts to say that your bill was not reasonable, meaning the provider charged too much. And they argue that the jury should award less for any individual bill. Next, they'll argue that the treatment wasn't necessary. The emergency room shouldn't have run a CT scan or an MRI, or your doctor shouldn't have done a specific procedure. They make those arguments as well. And then finally they say, hey, it's not related. They may have had this medical procedure done, it may have been necessary, but it wasn't related to the crash. And so those are the typical arguments that we'll hear at trial. Usually they'll hire an expert to come and make these arguments. Sometimes they'll imply them through just questioning about the bill and what was actually done and making it sound like it was an excessive bill for what was rendered. As we all know, medical bills are expensive. That's all there is to it. But in terms of the one line item that the jury fills out regarding past medical expenses, those are the three main arguments that we'll hear.